Hariom dosto. Today we are gonna talk about a topic which is spoken in a hushed tone but affecting millions of lives worldwide. We are talking about infertility. Yes, dosto, infertility. That very term denotes the unable to conceive after 1 year of unprotected sex. Yes, दोस्तों आज बच्चा नहीं होने के प्रॉब्लम से देश में ना कि पूरी दुनिया में बहुत सारे यंग कपल्स जूझ रहे हैं और इस समस्या में डब्ल्यूएचओ ने बोला आउट ऑफ 6 एवरी 1 कपल वर्ल्ड वाइड इज अफेक्टेड। ये प्रॉब्लम इतना बढ़ गया है कि आजकल जहाँ देखो वहाँ ही फर्टिलिटी सेंटर्स एंड फर्टिलिटी थेरेपिस्ट प्रिवेलेंट। सो दोस्तों दिस नॉट ओनली अफेक्ट्स द पर्सन फिजिकली इकोनॉमिकली मेंटली ऑल्सो। तो इसी के टॉपिक पे आज हम थोड़ा डीप डाइव करेंगे और जानेंगे ऑल द साइंटिफिक इंसाइट्स फ्रॉम गायनोकोलॉजिस्ट एंड इनफर्टिलिटी एक्सपर्ट डॉक्टर मेघना राज। वेलकम doctor to our show.
Thank you for inviting me on this show.
Doctor, as today's episode is on infertility, first we would like to know the term infertility in terms of medical field. Please enlighten.
Infertility is a term we use for a couple who is unable to conceive, but we refrain from using this term in recent days as it suggests that the couple will not be able to conceive at all. Because of the recent advances, they are able to conceive. So the word subfertility is used for such couple in recent days, which will suggest that they are unable to reproduce as per their potential and they may require some medical aid for this process.
Okay. So, ma'am, what would be the first step a woman should take when she suspects fertility issues? How can she really know that she is having some challenges in conceiving?
Yes, as a couple is trying to conceive, at least 1 year of unprotected intercourse is usually the time period which we tell them to try for. And if they are unable to conceive even after 1 year of their unprotected sex and they are facing issues with infertility, then only they should meet the doctor. But as of nowadays, because of the fertility issues are increasing in the trend, so in a woman who is above 35 years of age, we suggest after 6 months of unprotected intercourse or sex, if they are unable to conceive, they should consult the doctor so that they can suggest them for further evaluation.
Okay, they can rule out if any there are underlying medical condition which is preventing them.
And they can help them with their fertility
Yes.
issues. So do consult your doctor. They will give you a better idea of what is going on, what is the issue underlying.
Okay, thank you. What are the some common myths about infertility you have seen across your patients or during your practice days?
It's still today, the people think that infertility is mainly a problem in women only. So it's not true. As of now, as we see, in 100 couples which visit a infertility clinic, 30% of the women will have fertility issues. 30% it will be the male factor. The men will have some issues. In 30%, it is both of the couple will face the issues. And in another 10%, though all reports are normal, they are unable to conceive. So though all of your reports are normal, you may have some fertility problems in conceiving. So your doctor may aid you with this. So please do visit a doctor rather than thinking that, okay, all reports are fine, I don't need any help. But do visit your doctor. They will suggest you further on what to do.
Okay, ma'am, that was really nice to know that there are such an stigma around people, and you are helping the people wanting to be parents with this. So it's not just always women to be blamed. There are other challenging factors as well, including the male spouse, and also there are other unexplained reasons of infertility.
And still, men are very hesitant to visit a clinic and do get a test done for them. So it's very simple in male actually. It's just the sperm count what we check for. So it's a simple test. It will not require much of your time. So do visit a consultant so that they can help you with your further fertility issues if there are any.
Okay, right. So with this comes the obvious question, like what would be the common causes seen for infertility, both in men and women? What are the probable causes that we are seeing today?
In females, it may be because of ovulatory dysfunction. That is, the eggs and sperms which meet to form a baby will not be produced in the female. That is, the eggs which are produced in the female may not be formed properly because of the hormonal imbalance or other factors. So that could be one of the causes. Then there are fallopian tubes which are present in the female reproductive organs. So that may get blocked, which may hinder the meeting of eggs and sperms. So that could be one of the cause. Then there could be implantation problem. That is, once the baby is formed, it has to implant in the womb of the mother. So there may be issues with the implantation. So that could also affect their fertility. So these are few factors in female. Whereas coming to the male, there could be issues like the sperms counts may be very low, which may be a cause. And there could be various causes like varicocele, which may be the cause for the low sperm counts. Or there could be other infections like mumps, which might have happened in the childhood, which may have affected the sperm count. So there are various factors which may affect the sperm counts. Sometimes if the sperm counts are normal, even then there will be some abnormal forms of the sperms which are seen. They may not be normal in form, which are necessary for conceiving. So that will be only known only when you visit a doctor and get your sperm counts or semen analysis done.
Okay, okay. One more thing I would like to know is motility has a role, motility of sperm has a role in faster conception or something in males?
Sperms have to swim up through the uterus and reach the fallopian tube where they meet with the eggs, which are released in the women. So if there is motility issues, it will be difficulty to conceive naturally. But with the advanced in medical terminologies like ICSI, we call it as intracytoplasmic injection of the sperm. So that will be done. So that is very helpful in couples who are facing these problems of motility issues. So IVF would be a suggestion which we may give them according to their age factors and all this. Both male and females will be evaluated, and as per the couple, the best plan would be suggested to them.
Okay. As you have rightly mentioned, doctor, our hormonal dysfunctions, like if the ovulation doesn't occur at a certain period of time, and there may be other hormonal imbalances in the body leading to conditions like endometriosis and other adenomyosis, this type of issues. So, how do they actually play the role in struggle of infertility journey with the couples?
Yeah, as per the hormones, there is FSH and LH, which is released from the pituitary. We have pituitary glands in our brain, which releases. Yes, yes.
In the
There is a
hypothalamus
pituitary
and
organ.
hypothalamus. Yeah.
Yes, yes. Hypothalamus, pituitary, ovarian axis, we call it in the female. And in the male, it is called as hypothalamus pituitary gonadal axis in the males. So this releases hormones in both males and females. This will help in the production of the gametes. We call eggs and sperms as gametes in medical terminology. So they are produced only when this axis works finely. The hormones are released so that this balance is maintained. The hormones are released properly, which will help the ovaries and the testes, which are there in the males and females, to produce these eggs and sperms. So whenever there is a disruption in this, so there will be issues in production of egg or the sperms. So that will be helped only when the doctors do your hormonal tests. There are other hormones like thyroid, the TSH test, what we do, thyroid stimulating hormone. So that may also affect. Then there are prolactin hormone, which may be seen in women who are breastfeeding. But sometimes, even before conception, there may be some tumors in the pituitary, which may increase this hormone, leading to non-production of eggs. So all that needs to be evaluated. Then only the doctor can suggest them how to go ahead with the further process.
Yes, yes, doctor. Thank you. Doctor, I have also heard that stress, like increase in cortisol level, also inhibits the secretion of ovulation. Like prolactin is increased, raised, found raised in female.
Whenever there is a stress, the hypothalamus gets activated and leads to suppression of the other hormones. So leading to all these imbalances. So leading a healthy lifestyle, practicing yoga, and because of the stigma associated with infertility, the couple goes into more of stress, which further deteriorates their health. So we have to have a healthy lifestyle. We have to give them a mental counseling. They need mental stability, and they need to vent out their anger, frustration. So they need a psychiatrist help sometimes, because sometimes the male will not be able to perform only because of the performance pressure. So they'll not have this condition called as erectile dysfunction, which may happen. So all this are because of the stress which the couple will have to go through because of the societal pressure that, oh, you're married for so long, you don't have kids till now. So this all affects the couple's fertility as well. So it is very stigmatic for a couple to discuss with everyone. So they can visit the gynecologist or the urologist and the psychiatrist who may help with all these issues which they face.
Right. Even the society keeps on pressurizing the young couples, or maybe if there is some significant period of living together, marriage in a marriage institution, then they are being forced, like, you have to give us a legacy, or you have to produce some. People are wanting their grandchildren and everything, and this also puts in pressure on the both the couples, and mostly women are more vulnerable to this. Yeah. So, would you recommend them, ma'am, like some breathing exercises, yoga, or like pranayama, anything, or maybe as simple as like talking to a friend or counselor or therapist, or getting help to keep their brain sane? I'm talking like really about mental health.
The fertility process is a journey where they have to have patience, they have to have a mental stability. So at the first visit, we always try to evaluate at what stress they are facing and how can we help them with that. And also we suggest them the ideas like pranayam, which may reduce their stress, which will reduce their cortisol levels, which will help in the further fertility process. So all this, talking to a friend or a counselor or a psychiatrist, everything helps them with their fertility journey. So that is very essential part of seeing the patient. It's just not just seeing the reports. We have to see the person as a whole, how well they are doing.
Diet also plays an important role in achieving overall health. So, does there a particular form of diet or lifestyle changes a couple can incorporate to fast track their fertility journey, or if anyone, even a healthy person, can also follow?
Yes, yes. Whenever we talk about the diet, it's essential to have all the micronutrients and macronutrients included in your diet. So the micronutrients also play a vital role in reducing the oxidative stress in the body. So you need all the calcium, minerals, and all the vitamins are very essential. Vitamin D and
Iron,
all are
zinc,
very,
magnesium,
yes,
everything,
yes.
like
All the
in
minerals
proper
are
portion.
in a proper proportion. It is advisable. So always include your uh, fresh fruits and vegetables, green leafy vegetables, all this to be included in your diet. Avoiding deeply fried foods, the junk foods, all that would be suggested to the couple, both women and women. It's applicable to both men and women. And especially in males, we would ask them if they are working in very hot temperatures or they're wearing very tight clothings, that may affect the sperm counts because of the increased body temperature. So we would advise them to avoid those and wear loose clothings so that the sperm counts may not get affected because of that. And also any habits in male and female like smoking or alcohol consumption, all this have to be withheld if they're trying to conceive, so that the effect of these on the production of eggs and sperm should not be seen, which may affect the fertility in future.
Yes. Also, in doctor, would you advise incorporating like dry fruits, nuts, and seeds, which are rich in omega-3 fatty acids?
In a minor proportion, not much of nuts and seeds. so that the fat content, because they contain a lot of fats, so but they're good fats, so you can consume in a moderate proportion. Nuts, seeds, fruits and vegetables along with your regular diet would help you with all this. Proteins and fats and carbohydrates should be in equal proportions, not too much of fats and not too much of carbohydrates.
What is as per recommended by RDA, as per whatever that daily allowance? Yeah.
Fat consumption should not be more than 20%, in which saturated fat should not be more than 12% of the total fat consumption. Proteins, 1 kg per 1 gram per kg body weight of proteins is essential for body. And carbohydrates should not exceed more than 40 to 50% of your total diet intake. And it should contain as many as colors of food like green vegetables, and all colors of food should be there. So your whole plate should be colorful so that you contain all the micronutrients and macronutrients which are present in that. So all kinds of fruits and vegetables, they contain different, each fruit has its own essential requirements. So all the seasonal fruits especially, which are available in the possible seasons, should be consumed, which will help them get all these micronutrients like vitamins and minerals. So that is always suggested to them to have those with the food.
Yes, everything which is locally, seasonally, organically grown, that would be very much beneficial.
The pesticides and all those may have a effect on the hormonal imbalance again. So pesticide free food would be ideal to consume.
One more thing I have heard in a recent article about use of excessive chemical loaded shampoos or cosmetic or synthetic products, I should say, they have an effect on our endocrine system. Basically, they phthalates and BPAs and everything we use from plastics, these are endocrine disruptors. So they have an effects. I don't know about how much it is scientifically proven that our fertility journey might be affected, that our menstrual cycles might be affected by using excessive of chemicals loaded things we use, like.
Yeah, which are mostly good quality cosmetics have FDA approved chemicals in them. But if you're using a locally manufactured ones, sometimes there could be some contaminations in them. Heavy metals may be there, mercury and all those are sometimes seen in those.
Sulfur, then parabens,
Yes, yes.
this sort of.
Parabens and sulfates, they are usually best to be avoided because they are endocrine disruptors, which may affect your hormonal imbalance. So it is suggested not to use such things, and use a safer cosmetics if you're using it, because our skin and is a very large organ which will absorb most of the chemicals which are put on it. So we should be very thoughtful of what we are using. So
Yes,
ideal to go through the ingredients which are present in the cosmetics before buying them.
Yes, we should learn to read the label even in the food packaging also before we actually purchase them. Yes.
A lot of
because
preservatives are present in the
yes,
packaged food. So packaged foods are not advisable to consume.
Yes, yes. One more thing, like in middle class households, females generally tend to like hoard things in the term of whatever is expired or something. Maybe in terms of cosmetics, maybe in terms of food, they think they will eat up, but the whole family should be safe. So they always compromise with their health. I should say, I have seen this instinct in my mother, in my grandmother. So that's why I have raised this topic that females think, no, no, मुझे तो कुछ नहीं होगा, अच्छा एक्सपायर हो गया कोई नहीं, पैरों में लगा लेते. So rightly you have mentioned that our skin is the largest organ of our body which is absorbing all this through the pores. So we should be also mindful what you are eating, not only what you are eating, but you're applying on our skin also.
Yes, that's right.
Yes, this is the thing that I have seen in, like, even in my house. That's why I think most of the people might have doing this common mistakes.
Yeah, these are the common mistakes which women do. That's such.
yes,
So sad, but I hope recently India is changing, and with this our vision for health is also might be changing. Yes.
yes, yeah, very true.
The
Uh,
podcast like this should help them to get knowledge regarding all this. So you're doing a great job doing.
Thank you, and we are grateful indeed at Abhyudam that we are having you on this topic to enlighten us. Ma'am, with this, I would like to go again back to the fertility process. Like, what are the medical science has fertility testing techniques or procedures? How a couple is taken care of when they visit a doctor?
Yeah, in the first visit, we like to undergo some tests which we do. Like for the meal, we ask for a semen analysis after 3 days of abstinence. So they are asked to give a semen sample, which will be tested according to WHO manual, which we have. So we check for each and every parameters, like what is the count, how much motile sperms are there, how much normal shaped sperms are there, how many abnormal sperms are there. Sometimes there will be a lot many dead sperms. The sperms will be there, but they'll be already dead, which may not be useful for fertility. So how many dead sperms are there? All these parameters are evaluated, and we have the parameters below this. If the sperm count goes below this or the motility is below this, the chances of pregnancies are very less in those couple. So there we may have to suggest them some medications, like we have all the micronutrients and all the oxidants, antioxidants, which are there to reduce the oxidative stress. Because of the oxidative stress, we eat so much of junk food and all this. This increases the oxidative stress in the body. So to prevent that, we will have to suggest them to have some antioxidants. And if there are hormonal imbalance, the sperms are not being produced, FSH and LH levels are abnormal, we will have to treat according to that. So these are few steps in males, and in females we check for ovulation, whether she's having regular cycles or not. Like in PCOS, they may not be having ovulation and having irregular periods of 2 to 3 months. They get their cycles in every 2 to 3 months. So we'll have to regularize their cycles. And we may suggest them drugs like ovulation induction, which will help in producing the eggs in the females. And we will have to track their ovulatory cycle. How long is their cycle? And whether the eggs are produced or not. We can do a follicular study by using ultrasound to see how the eggs are growing each day of the cycle. If they're not growing, we may help that with the medications like ovulation induction drugs. So these are some of the things. And also we check for the tubal patency. The fallopian tubes may be blocked in few females. So there is a test called as HST, hysterosalpingography, where we do a X-ray by injecting a dye into the female. It may be slightly invasive, but still can be done to check for the fallopian tubes. Or if they have some other issues like fibroids, and there are endometriosis, which will have severe pain during cycles. So in such conditions also, we may have to do some surgeries like diagnostic hysterolaparoscopy. So we see into the uterine cavity and also into the abdominal cavity, abdomen of the woman. So we have to go into the cavity using a camera that is called as laparoscopy. So these procedures will help them evaluate their condition and also treat in the same setting.
Okay, okay. Maybe endometriosis may have been severe, like stage 1 to 4. There may be.
We have
Or even
various stages in the endometriosis. The initial stages can be treated with surgery sometimes, depending on the case severity. We will have to look into that.
Yes, yes.
yes, and are there any effect of AMH? People nowadays talk about low AMH cycles, anti-Muralian hormone. So, are there really effect of this AMH on infertility?
AMH can give you just an idea of how many follicles are left within. It is an indirect measure for your egg reserve. We have a limited reserve in the women. So when we are in the womb as babies, we will have nearly 4 million eggs inside our ovaries. So by the time we are born, we
Okay.
have 4 lakhs or 5 lakhs eggs, or 1 lakh of egg will be remained in our body by the time we are born. And by the time we attain puberty, that is when we get a cervical menarche, what we call it as, by then we only are left with 40,000 eggs. So these are constant in a woman, which is from their birth. It is constant. And in every cycle, 1 or 2 eggs will be released. The rest of the eggs, which are recruited sometimes, will get destroyed. So by the age of 40 or 45, most of the women will stop menstruating. Nowadays, it is slightly earlier. Initially, it was 45 to 50. Nowadays, we are
Hmm.
seeing very common cases of premature ovarian failure, we call it as. By 30, 35 only, they have cessation of their periods. So they're not getting any more of periods. So in such conditions, it is very essential to see how much of egg reserve is remaining in this woman so that we can tell them to go with the fertility treatment aggressively. So in such condition, it will help us. AMH will tell us how many egg reserve she is left with. So it's not just the
Okay.
only indicator, but it is one of the indicators which we do. The other things are like
Okay.
on the second day of periods, we do a antral follicular count by a scan. So that will also give us the idea.
With this, we can really say now that there is an ideal reproductive window for every female, as some women are like having heading to menopause in the early 35, 40s, and some are still being who are in a good lifestyle and who have a good physical activity involved. They might be around late 40s. Yeah, so it's
There is
really
So mainly
difficulty.
it might be genetic. The ovarian failure may be a genetic uh, condition.
Okay.
So sometimes it will not only be because of your lifestyle changes, but it's mainly because genetics also play a role here. So sometimes if the woman's mother had a premature failure, very highly chances that she will also have early premature ovarian failure. So
Okay.
we have to consider that also, genetics also into consideration here, not just the lifestyle. So it is
Hmm.
suggested
So
to have conception before 35 years of age would be.
would be ideal.
ideal. Yes, I was coming to that. So what would be the, so it is best if can be done in late within 20s, 20 to 30 years.
And
Yeah,
if
early 20s would be ideal for having a good fertility rate. But because of the education and all this, the women are choosing to have career and education. We are seeing more of women conceiving in the late 20s or
hmm,
late 30s. So sometimes we may have issues like Down syndrome, which is very common in late pregnancies. The
what is
woman
this?
above 30. Down syndrome is a condition where the baby has an extra chromosome in the 21. We have 46 chromosomes, which form
Yes.
23 pairs. So there is 21st pair, which has uh, each pair should have two chromosomes. But sometimes what happens as the mother's age increases, there are chances that one chromosome may be extra in the baby. So that causes something called as Down syndrome, where the baby has mental retardation and will have other medical abnormalities. So you may have heard of mongoloid faces, uh, and they have mental retardation. They are unable to have good academic success. So such kids require additional help because of their mental retardation. So that can be detected very early during pregnancy. We have many tests which we do now to rule out any Down syndrome in the fetus which is to be born.
Okay.
So you have to follow up with your gynecologist or your obstetrician. So they will help you in helping detailedly regarding this condition. But there are increased risk after the age of 30.
So
It can happen in younger age too, but the chances are very less, like 1 in 20,000, 1 in 30,000. But as the age advances, once you're 1 in 35 and above, the risk increases to 1 in 200 pregnancies will have such risks.
hmm.
So it is advisable to have a earlier pregnancy if possible.
If possible. Yes.
Yeah.
This comes the challenge for most of the career oriented women, because they are starting careers late, and might be the marriage is also late, and along with the modern lifestyle, it's become really a challenge to keep your fertility intact. Okay, so what are the treatment options available right now in this medical field for helping the couples?
Yeah, as we were discussing, there are options like ovulation induction, which will help them produce the eggs which are available. Then there are procedures like IUI, that is intrauterine insemination, where the sperms of the husband or from the donor, if the husband is unable to produce sperms, can be injected into the woman by medical procedure. So during the ovulation period. So that will help them conceive. Or there is IVF, where you have in vitro fertilization, where we meet the gametes, that is eggs and the sperms, in a petri dish or a outside test tube, what we call it as test tube baby. That is one more option. Recently, we have ICSI, where we inject the sperms which are non-motile. The husband have non-motile sperms, we inject directly into the eggs of the woman under microscope. So that is the newer advance which we have, ICSI procedure. So that can be done. And if the sperms are not produced, we have some procedures called as TSAR, where we extract the sperms from the testes of the males. So if they are unable to produce the sperms, there is some damage in the genital tract of the males from where the sperms are to come outside. So we can go into the production process where the sperms are produced, and we can extract the sperms from there. So that is one more advancement which we have nowadays. So that also we can be done. And also there are some conditions in male where we need to do surgeries like varicocele, where the fluid is collecting in the scrotum or the testis, around the testis, or they may have torsion. So if they have torsion and all those, that may have affected their sperm counts. So we'll have to look into those and treat according to the case to case.
Okay, okay, got it. And then lastly, if nothing works, then there is the IVF, I guess, for the
Yeah, IVF. And there also we have an option, as I told you, like there are no sperm available, or we may have to go for sperm donation or egg donation. So both are available. If women don't have eggs at all, where the AMH level has completely dropped, or they have stopped menstruating, so completely eggs are not at all available, we may get an egg donation. If the sperms are not at all available, we may have to go for sperm donation. So these are also some of the options which are available. And there is also provision for sperm preservation or cryopreservation, what we call it as. The sperms can be freezed and kept for further use. If they have some testicular cancer or any other things, they have to undergo chemotherapy. So this may affect their fertility. So during the before they undergo these procedures, so they can preserve their sperms for further use if they're not married yet, or if they're not planning for kids right now, and they have to undergo chemotherapy for some cancer or any other thing. So they may preserve their sperms, or even in women also, they may preserve their oocytes. We call it as oocytes, or the eggs. They can freeze their eggs and keep it for further use. So these are a few of the recent techniques which we have, which will help them conceive in a later date.
conceiving a later age when they're willing or when they're financially supporting, they are planning to have the baby.
Yeah,
Even
yeah, yes.
few celebrities I have heard of are have gone for egg freezing and
Yeah,
they
that
freeze.
is because of, like, as I told you, Down syndrome chances are very high when the age of the woman increases. So when they're
Yes,
young, if they freeze their eggs, there are high chances that it will be good for their future fertility. So that's why some women prefer that when they're planning that they have to focus on career and they want to marry late. So that is one more option which is available.
yes, right. So, Doctor, thank you for all the wonderful information. Lastly, I would like to ask you for a final piece of advice, for those who are, we know infertility can be emotionally taxing. It's physically, it's challenging, and economically, yes. Also, there
Yes.
is emotionally lot of burden from the family, from the society's fears. So, what if couple can have those high hopes and they can really look for what would be your piece of
Yeah.
advice?
Infertility is a challenge which is different in each couple. So just don't think that, okay, it is not possible by us. It's not always IVF. We have many other procedures which may help you in fertility. Not all couples may require IVF or higher cost procedures. So it depends case to case. So just visit your doctor, take their suggestion, and then go ahead with as and when it is required. So they will be giving you a better picture of what is required for your fertility. So not everybody will require high cost procedures to be done. So just a simple ovulation induction tablets may help them conceive in many cases. So that's also there. So some may require, what the myth is that everybody will require IVF if they go to a infertility specialist. So that is not the case. So just after your evaluation, the doctor will be able to give you a better suggestion what is required for you, and accordingly you can go ahead and have the procedure done.
Yes. I would like to say, ma'am, whatever I understood from this podcast, like as soon as you suspect any of your fertility issues or any kind of irregularity with your menstrual cycle, or if the irregularity with the males also in terms of when they are physically active or any kind of unsignificant changes in body, then they should visit the doctor at the earliest, get themselves checked up,
Yes,
and
yes.
so that doctor can help them in fulfilling their whatever the resolve, yeah, they want to do. That
Yes,
was
yes. The earlier you visit the doctor, the chances that the doctor can help you in a better condition. As I told you, after 1 year of unprotected sex, if you're not able to conceive, then it is suggested to visit the doctor. And if a woman is more than 35 years of age, then after 6 months only we suggest them to undergo evaluation, because there is a time period, as I told you, that their eggs
yes,
may be reducing in number. So as early they can visit the doctor would be much better. So after
much
6 months of marriage, if they're not able to conceive, better visit a doctor. And before 35 years of age, after at least 1 year, you can try for conceiving the baby. If you're unable to conceive, then do visit your doctor and get the suggestion done.
better. Thank you, doctor. Thank you so much. From the bottom of my heart, I would like to thank you and give you immense gratitude for enlightening us on this topic, which is really need of the hour, which I felt. And
Mm.
thank you for giving time. I know
Thank
you
you
are
for
very busy.
giving me this opportunity. Yeah.
Yeah, we are
Thank you.
glad to have you on our show. Hope to meet you soon. Thank you. Hari Om.
Thank you.